Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the government is taking a huge step against the coronavirus disease, eyeing mass testing starting April 14. The National Bureau of Investigation is looking at individuals spreading fake news online amid the health crisis. But what are the boundaries of free speech and expression? Human rights lawyer Chel Diokno tells us more in the program. And later, get to know a story from the front lines. An infectious disease doctor shares what gave her strength despite the risks and challenges. The country should expect massive testing for COVID-19 by April 14. COVID-19 National Action Plan Chief Implementer Carlito Galvez says they're hoping to conduct tests on persons under monitoring and investigation to contain the virus. So far, there are 9 hospitals accredited to conduct testing for COVID-19. Galvez is calling on the health department to speed up the permits of other testing facilities.
We're also determined to fast-track the accreditation of substantial laboratories so we can start to the massive testing of the PUIs and the PUMs. We expect that by April 14, we shall be able to start massive testing.
A human rights lawyer reveals that the National Bureau of Investigation is now going after ordinary citizens who are voicing their dissent. In a tweet on Thursday, Attorney Chel Diokno posted screenshots of a subpoena received by one of his clients. NBI Cybercrime Chief Victor Lorenzo said they have sent at least 17 subpoenas so far, but Lorenzo denied accusations that they are suppressing freedom of expression. Among the fake news the NBI is looking into are posts about the supposed extension of the Luzon lockdown, another on a supposed nationwide lockdown, and that the military will spray chemicals all over Luzon. Let's go straight to the source of the story. We have human rights lawyer, Attorney Chel Diokno. Attorney Diokno, welcome to the show, sir. All right, Attorney Chel Diokno, can you hear me, sir? All right, so there are a number of topics I'd like to discuss with Attorney Chel Diokno, aside from taking on the case of, well, an individual wherein the NBI issued a subpoena for supposed fake news. We want to talk about also PACC's Commissioner Manuelito Luna asking the NBI to probe Vice President Leni Robredo on solicitations and actions that supposedly, what he says, undermine government efforts to combat COVID-19. There has been a clarification also from the PACC regarding this. Greco Belgica was actually saying that that was the stand of just one of the commissioners, Manuelito Luna, and not of the PACC. This has, of course, brought so much controversy, especially online, with netizens asking what is really, why investigate the vice president for contributions? All right, contributions and solicitations that the office of the vice president has actually gotten. So I think we have Attorney Chel Diokno on the line. Attorney Diokno, welcome to the show, sir.
Good morning, Pinky, and good morning to everyone who's watching, listening. Hi.
Thank you for joining us, Attorney. First, I want to talk about the case, well, not the case, the topic on Vice President Leni Robredo. What are your thoughts on the Presidential Anti-Corruption Commission's Manuelito Luna? Let's specify that there, sir, that it's Commissioner Manuelito Luna asking the NBI to probe Vice President Leni Robredo for illegal solicitations and actions that undermine government's efforts to combat COVID-19.
Well, I think it's not the kind of thing we need today now. What we need is really for everyone to work together and to welcome all efforts that will benefit people. And it's very divisive to go after the Vice President when actually wala naman siyang ginagawang masama. Gusto lang niyang tumulong. And I think the real point of everything we're doing now is trying to do the best we can given the situation and given the limitations that we're all under. Kudos, to the Vice President, because from day one, she's been focused on simply providing what the people need. And that's what we all have to do, I think.
Mm-hmm. But, I wanted to ask you, Attorney Chel, when illegal solicitations come into play, according to Manuelito Luna, what actually constitutes illegal solicitations? Because from my understanding, that would probably be soliciting and pretending that the money will go to an organization, a fake organization, or a fake cause. In other words, ang ibig sabihin po nun dapat ay nanluloko ka. Hindi ho ba?
Yun, exactly. Yung mga fraudster, yung mga scammer, yung nakikinabang dito sa ating emergency, yung naghahanap ng paraan para kumita na hindi naman tama. Yan ang mga sanang habulin ng ating pamahalaan. We really need to work together, especially now, because, the poorest of the poor communities in the enhanced quarantine areas, they're really feeling it. Sama-sama ng tama sa kanila. Sana mabigyan talaga natin ng tulong ng mga kapatid natin nasa laylayan.
Yeah, the Vice President has provided, PPEs, that's ready, free transportation service, a dorm for health workers, and even food for the police and the military who are manning checkpoints. Do you see anything, sir? I needed to ask you this. Anything illegal, unusual, bad about that, sir?
Absolutely not. And that is really one of the most urgent needs from day one, is to provide what our frontliners need. And you will notice that VP Leni did this without having to exercise any kind of additional powers from what she already had in her office as Vice President. I don't see anything wrong with it. I think we should even be congratulating her and hoping that others in government emulate what she's done.
Senator Ping Lacson tweeted, sir, and I quote, PACC's COVID-19 motto, lahat ng tutulong, ikukulong.
Maganda yun na. Pwedeng meme yan. Alam mo, yung kailangan kasi natin ngayon ay, it's a question of, sabi nga nila, bayanihan daw. Yung bayanihan, hindi divisive yun. Hindi exclusive yun. Inclusive yun dapat. At yun ang inaasahan ng taong bayan, na magkaroon tayo ng ganyan na isa talagang yung unified ang ating galaw.
Okay. We need to bring this in, of course, Attorney Chel, that there's a statement by PACC Commissioner and Spokesperson Belgica. He said that the call of Manuelito Luna was a personal one, and that the PACC is not asking anyone to investigate Vice President Leni Robredo. On the other hand, we are thankful to everyone who are helping the frontliners and the needy, including the VPs. So what should happen next? Should we put this to rest, or what should the PACC do to Manuelito Luna, who issued such an appeal to the NBI, sir?
Mr. Luna should have made it clear when he made that declaration that he was not bringing in the agency that he was representing. He should have made it clear that he was speaking in his own individual capacity. When he did not, I think that is the root of all this misunderstanding and divisiveness. And everyone in government must understand that when they speak up and make a public announcement, they are speaking on behalf of their agency. I think that this is a lesson for all government officials, not just those people who are in the PACC, but everyone who decides to make a public announcement, dala nila yung kanilang opisina. At mabuti siguro pag-isipan nila ng maigi kung meron silang sasabihin. In fact, as I understand it in government, this is usually cleared first with the higher-ups before any kind of public announcements, especially something as controversial as this, are made. So maganda siguro magkaroon din ng pananagutan.
Higher-ups?
Yes, I from my own experiences and my interactions with
Chel Diokno.
government. Yeah. So for my own experiences with the government
You said
interactions.
higher-ups. So this is also...
Yes. I'm sorry, you're a
Chel
bit
Diokno,
choppy.
go ahead, please.
Yes, as I was saying, that that there has to be some kind of explanation here, because we don't usually hear government officials making statements as controversial as Mr. Luna did without any clearance from anyone else in the same agency. Now, if he was really speaking in his personal capacity, it should have been made very clear from the start that he was doing so. And dapat nanggaling sa kanya, hindi dapat nanggaling sa kay Mr. Belica.
Because you said that, Attorney Chel Diokno, I wanted to bring this in as well, that the DILG is saying that summon by the NBI on Pasig City Mayor Vico Soto. We spoke to Undersecretary Jonathan Malaya of the DILG yesterday, and he said that, really, that topic, that issue should be case closed. Sabi niya, it's a useless political distraction. I bring this in, sir, because you're talking about Manuelito Luna also speaking on behalf of the agency also that he represents, and dapat meron pong sinasabi yung parang approval from the higher-ups. So ito naman po, the NBI, hindi naman po suportado ng DOJ yung kanilang ginawa, and the DILG also questioning why the NBI did this. Is this what, sir? A lack of communication, lack of coordination?
Sana ganun lang yan. I wish that the government would act as one. In fact, the whole theme has been we heal as one. Then I think it's incumbent upon the government to act as one. And these kinds of statements that later parang binabawi na lang ng basta-basta, hindi naman maganda yun. Ang talagang hinahanap natin ay sama-sama na natin ayusin itong problema. Let's all work together and deal with this public health emergency. We don't have time to be sidetracked by all this talk about filing cases against Mayor Vico, filing cases against investigating VP Lenny. Wala tayong oras dyan. Our problems are just too grave to be sidetracked by these statements, and then to find out only later na binabawi naman pala.
Okay, you're taking on a new case, Attorney Chel Diokno. A client of yours received a subpoena regarding, he or she needs to show up at the office of the NBI on April 7 regarding, what is this, sir? What is the topic? What did your client do? What was the topic of by which he tweeted this, or he posted this on Facebook, sir?
I wish I could answer your question, because we are in a quandary as to what is the act that my client did that allegedly violated the law. The only paper he received was a single sheet of paper entitled subpoena, which only said that he was being investigated for violation of Article 154 of the Revised Penal Code. Article 154 is an old provision that penalizes publication of false news as news. In other words, if you're peddling something to be real news but actually it's false, then you could be penalized for that. Ang problema namin ay hindi naman nila sinabi kung ano yung mismong post o binanggit ng aking kliyente that constitutes the crime. So we have no idea. All of us, my client is just an ordinary person. He has posted lots of things. He's expressed his opinion online like so many of us have done. So we feel it's so unfair that we now have to guess which of those posts are supposedly violating the law. So what I hope that the NBI does is they provide us with the basis for the issuance of the subpoena. If there's a complaint, give us a copy of the complaint, any supporting documents, so that we will be in a position to respond intelligently. It's just basic fairness, I think, that should happen.
Okay. I'll ask a last question, Attorney Chel Diokno. How is one supposed to defend himself against an alleged violation if one doesn't know exactly what he's being accused of?
Yun na nga. At ang balita ko more than, I think, 17 or I heard 20 plus similar subpoenas have also been issued by the NBI. Well, ang mapapayo ko lang unang-una kung nakatanggap tayo ng subpoena ng ganyan ay kumuha na tayo ng abogado. At yung abogado dapat ang makikipagtanggol para sa atin. Dapat kasi malaman natin kung ano yung basehan for the alleged violation at dapat bigyan tayo ng sapat na pagkakataon para sagutin naman yung sinasabi nilang demanda.
Sir, very quickly, no? We've run out of time, but will you show up together with your client not knowing what the allegation really is?
Well, I am definitely going to show up. I'd rather spare my client the indignity and the having to risk going out just for this. I can do it for him.
Maraming salamat po sa inyo, human rights lawyer,
Sure.
Attorney Chel Diokno. Thank you, sir. The fight against the coronavirus can be both physically exhausting and emotionally draining, but those on the front lines are choosing to stay on. Get a closer look into the important work they're doing after the break. This is The Source on CNN Philippines. You're watching The Source on CNN Philippines. Compassionate and hard-working professionals are on the front line to battle the coronavirus. First responders and health workers are doing way more than just their jobs. And on social media, some of them are giving the rest of us a window into the difficult and importance of the work they're doing. The nonstop effort is incredibly draining and at times heartbreaking. Just like this photo of a doctor sharing a meal with her husband in the car between her hospital rounds. And she's the one we're going to speak to. Let's go straight to the source of the story, internal medicine and infectious diseases doctor, Daisy Tagarda. Dr. Tagarda, welcome to the show. And I see you're in the car again.
Yes, good morning, Pinky. Good morning to everyone who's watching your show.
Thank you for joining us. You know, I read that you actually go to 4 different hospitals, being the head of the infectious or infection prevention committee or control committee. And that photo before we showed you live was a photo of you in the car with your husband eating your meal. Mukha ho siyang baon. Parang dinala ata ng asawa niyo doon sa kotse para kung makakain kayo. Is that your new normal now, Dr. Tagarda?
Yes, it's very hard for us to look for an open restaurant or kahit fast food man lang. So what we do is we usually bring food with us. Actually, yung kinakain namin during that time is given by a friend na sabi nila, kainin mo to, si Millet Pumaren, no? So this is usually our daily routine. No, we eat in the car. Right now, we're in the gasoline station where I usually take coffee break. So doon na kami sa gasoline station nagko-coffee break just to have some rest, to have another energy to look for our patients, COVID patients.
Dr. Tagarda, now you're on your way to the hospital. Tell us what your day is like. And I want to know, how do you prepare yourself, for example, for today, going into the hospital and taking care of your patients?
Okay, so I usually wake up around 6 o'clock a.m. and then I prepare, I take a bath, and I eat breakfast. But in between, I have a lot of calls. So I know a lot of consultants, infectious diseases specialists would relate to me that we have nonstop calls from different hospitals. And then we prepare. Okay, I'm lucky that I have a husband who will drive for me in different hospitals and then leave our house at around 8 o'clock a.m. and then go to the different hospitals. So right now, I estimate number of inpatients, 35 patients that I have to see every day. So I usually finish around 6 p.m. So non-stop na rounds to, no? Hindi talaga tumitigil. I only take a break to drink coffee and eat lunch or at least merienda. I have sandwich inside my bag so to make sure na hindi bawal magutom ang frontliners.
Napapagod ho ba kayo, doktora?
Yeah, yes, oo, nakakapagod talaga. Lalo na, no, we have thin force right now. There are a lot of doctors who are under quarantine, even nurses. So nakakapagod yung rounds. Ang PPE itself is time consuming at the same time drain din siya ng energy, mainit sa loob ng katawan. It's very difficult to breathe with you using an N95 mask. At the same time, kapag nag-expire ang pasyente, we are not happy. It's emotionally draining, especially if you learned that some of your colleagues are already affected. So ito yung usual na nararamdaman namin. Pagod, not only physically, but also emotionally.
I want to ask you, Dr. Tagarda, what's the best thing about your job? I can understand. Nakukuha ko na po ano yung worst thing. You just talked about that pag nawawala po yung inyong mga pasyente. But what keeps you going?
Well, of course, yung family first, no? Yung family natin, lalo na yung mga anak ko, they are my inspiration because I do this for them para hindi naman sila mahawa din sa sakit. Second, ang isa sa mga inspiration ko yung mga patients ko. I cannot describe in words on how I feel every time na may complete na nagre-recover sa sakit na to. Some of them even cry in front of me. So pati ako naiiyak na rin, no? These are very priceless fulfillments for us frontliners. So ito yung keep going. Of course, support din. Actually, kasama ko yung husband ko ngayon. Ano? Kasama ko siya ngayon. Pinagda-drive niya ako. Oo.
Hello!
Hello
Yung si
daw.
husband ho ba, doktora?
Hi.
At any point sinabi sa inyo?
Oo.
Hello? At any point sinabi ho ba niya sa inyo, Dr. Daisy, na maybe you should stop first, pahinga ka muna, pasyado ka ng pagod, and maybe dumating ho ba sa punto na sinabi niya, natatakot na rin siya na baka maapektuhan na yung pamilya niyo, you, your kids, and him physically?
Of course, no. At the start of this crisis, no outbreak, he told me that yung fear for the family and fear for us, but he witnessed the passion para gumaling yung mga pasyente, and he realized the certain goal that it is not only for our family but for other families as well, that if we worked on it, kayang-kaya nating lagpasan ito. So very supportive siya. Nung una, medyo natatakot, hindi din siya nakakatulog for several nights. But eventually, no, naging very supportive naman siya.
Doctor, as a last question, what do you want to tell the
Yes.
public?
Okay, thank you very much, everyone, for the praises that we are receiving for us frontliners. I'd like to ask again for support, no? Please do not discriminate our frontliners, not only doctors, especially our nurses, our nursing aides, our orderlies, no, who clean for our patients, and for you to stay at home. So these are the indirect way for you to help us. And if you want to donate for PPEs, we need more for our healthcare workers. Thank you very much, Pinky, for this interview also.
And I want to thank you. I should thank you for this interview, and to your husband as well, Maraming salamat po for giving us your time and good luck. Stay safe. Dr. Daisy Tagarda, maraming salamat po sa inyo. Thank you.
Salamat din po. Salamat din po. Thank you.
So, music heals, and through the gift of music, people around the world are expressing their gratitude to brave frontline medical workers who are fighting the coronavirus. Local artists here in the country are also doing their share, like OPM icons, Lea Salonga, together with her live Facebook concert. Concert king Martin Rivera even wrote an original song that pays tribute to all the doctors who have passed away due to the COVID-19. The song Buhay Mo, Buhay Ko also assures frontliners of a better and brighter tomorrow. He wrote an English version of the song, and here's a sample.
And now the time has come to love each other, standing tall, protect us all from harm. We are one soul, one heart forever. You're not alone, we're in this together. You give your life, so I live mine. You are my life, and I am yours.
Thank you for joining us here on The Source. I'm Pinky Webb. Keep it here on CNN Philippines for news you can trust.
Standing tall, protect us all from harm. We are one soul.